Hi, my name's Tony Barnett. I'm the lead physio with Northern Ireland Senior Ladies Football Team. Today I'm going to show you a taping technique for a lateral patella malalignment. I have to point out that this is not a standalone treatment, but used alongside a physiotherapy rehab program. For this application, we need three different types of tiger tape. We need the 7cm rippable EAB, we need the 4cm tiger tan, and we need the Hypafix fixation tape, all available from Physique. Okay, so the first part of the technique, we want to make sure that the knee's in slight flexion, and we're going to put two pieces of Hypafix tape down. Make sure that it's long enough, especially on the medial side, so that the tape can fix to it. Okay, so we want to make sure we cover both the inferior and the superior poles of the patella. If you have to use three pieces, that's fine. This is the 4cm tape. I think there is another one available, 5cm or even a 7cm. Okay, so slightly overlap it as long as the inferior and superior poles, and there's enough tape on that medial side, because remember, we're going to glide this patella medially. Okay, so the first piece of tape that we put on is the tiger tan. So we start on this lateral side, right in the middle, okay, and we put it on until we get up to that lateral border of the patella. Then we glide the patella, and at the same time with our fingers, we are pulling the tissue towards us, and we lay down and rip off. Okay, so that's the first piece in place. Make sure that the fixation tape is wrinkled like this. This is showing that we're pulling the tissue up towards the patella, so that we do away with that lateral glide. Okay, so the second part, again, we're going to start on this lateral side. Right to this posterior pole of the patella. Then we want to put in a rotational pull and fix down over the top of the last piece. Okay, that does away with that rotational pull on the patella. And the third part, what we're going to do, the other two parts, we started laterally and we went medially. We're literally going to start on top of the superior pole of patella. And what we're going to do is we're going to put a pressure down, lifting the inferior pole, tilting the inferior pole to take the pressure off the fat pad underneath. So we start directly on top of the superior pole, we apply pressure down and fix. Okay. So that's your taping technique for lateral patella mal tracking. What I would do then with the 7.5, I would just secure it all in, especially if we were going to do some sport with the rippable, just a matter of covering the application.